Listen up, parents. Did you know that fighting cavities begins before your baby has any teeth? Hi, I'm Dr. Ellie, and this is part 2 in the series of how to look after baby teeth. If you missed part 1, it's here. So what do you do if your young child has cavities? This is always very upsetting for a parent, and cavities can start early. If you're a young mom and you just gave birth to a baby 6 months ago, you probably are going to see baby teeth starting to come through the gum. And the minute that a tooth is in the mouth, it becomes a magnet for plaque bacteria. And these plaque bacteria are special kinds of mouth germs or bacteria that have little sticky pads, so they are able to attach to a tooth, even a brand new baby tooth. And as it multiplies, it becomes stuck to more of these bacteria and they form blankets, one layered upon another. And the problem for a nursing mother or a baby that's drinking milk is if the plaque bacteria get thick enough, if you don't help the baby clean away these plaque bacteria, they can become so thick that the ones closest to the tooth on the inside surface will change and become anaerobic. That means they live without oxygen. And anaerobic bacteria are able to ferment milk. Now, this is a real problem in a child under the age of 1, because the chances are they are actually drinking milk continuously every few hours throughout the day and night. If this milk is being fermented by these anaerobic plaque bacteria, that's when you can get aggressive tooth decay in these brand new, less than a year or 2 old baby teeth. This is why I urge mothers, take a moment, lift the lip of your child's, underneath the child as the teeth are coming in, and try to clean, get a cloth, a very soft cloth, dip it in a little bit of xylitol. This is the sugar from birch trees that I recommend so avidly, because if you make a small solution, warm water and a few crystals of xylitol, get a little cloth, or if you prefer a toothbrush, a very soft baby brush, and just clean under the lips, right up where the teeth meet the gums. That is the most crucial place to be sure anaerobic bacteria are not growing. Ask any mother who takes their child to the dentist at a year or so old, and the dentist will lift this front lip and say, look, we have tooth decay. And it's a line right across those 4 front teeth usually. And it's a tragedy. If it's allowed to go too long, this cavity can travel right through the tooth. And in actual fact, sometimes teeth don't look as if they never even grew. When I was a dentist in England in the 70s, babies were given a drink called Ribena. It was a blackcurrant drink that would be put in a baby bottle. It was promoted for strong bones and healthy teeth because it had a lot of vitamin C in it and other good phytonutrients from the berries. The problem was that it had a lot of sugar in it. And if that baby was holding the bottle, sucking on that bottle for a long time every day, the sugars could feed these plaque bacteria, and some mothers thought their children never grew teeth. And it's so preventable. You get a few crystals of xylitol, the little granular crystals, dissolve them and wipe over the baby teeth. If you're a nursing mom and you want to be comfortable at night and feel you can just nurse on demand and let the baby go back to sleep, that's fine, providing you have wiped the baby teeth during the daytime. You want to wipe them with xylitol maybe 2 to 3 times during the day. At your meal times, if the baby's awake, use that as a time to remember to clean the baby's teeth after breakfast, after lunch, and after dinner. Or if there's a nap schedule that works, do it before the baby takes a nap, perhaps, before you feed and nurse the baby to sleep. So these are the ways you can avoid cavities in these very young, newly erupted, less than a year in the mouth baby teeth.
What do you do if you already are at that point? You lift up the baby's lip tonight and you see this brown mark up at the gum line. Clean the tooth. Perhaps you could apply a tiny little bit of a toothpaste. I would get a kid's toothpaste that tastes better. Put a tiny amount, a quarter of the size of a green pea, just a little drop, and maybe wipe it with a Q-tip over the cavities. You want a toothpaste that contains sodium fluoride, not stannous. Be very careful because stannous is toxic and aggressive. You want sodium fluoride. It's a gentler kind of fluoride toothpaste. Buy one for children. Take the tiniest amount and wipe it over the cavity that you see. And if you do that as you clean these teeth 3 times a day, you may be able to stop the cavity. And what you will see, how you will know that's happening, is the tooth will become shinier and the brown of the decay may become darker. It may become more of a chocolate color. That means the decay has stopped. If you don't want to do this, you can take your child to a dentist and ask them to apply something called silver diamine fluoride. It's known as SDF for short. And silver diamine fluoride actually stops, the silver is antibacterial, it will stop the decay, and the fluoride will have the same effect as the fluoride toothpaste. It will actually make the decay go black. That's because it's stopped. It's called arrested decay. You can do it yourself at home if you're in a place where you don't really want to go to a dentist or you can't go to a dentist. I have clients in parts of India that cannot get to a dentist. You can get some children's sodium fluoride toothpaste and try to do this for yourself along with xylitol. Now let's take the child a little bit further down the road. In the 2nd year of life, that child is going to start erupting teeth at the back of the mouth. Usually these take a little bit to come through, and I can assure you, in my experience, if as they're coming through, you coat the teeth with xylitol, it appears they cause less problems. You get less distress. You get less swelling. It sort of keeps the gums healthy as these new teeth come in. And these are the new baby molars at the back of the mouth. And these baby molars can be quite big. And the surface of them is crisscrossed with these things that they call fissures. They're little grooves. And those grooves are the habitat for bacteria. Your mouth, a healthy mouth, can have up to 800 kinds of healthy bacteria. We've only ever heard about plaque bacteria and the bad ones that cause gum disease, but there are hundreds of kinds of good bacteria. And what we want is to encourage those bacteria to get into these grooves. And they've been doing this in other countries for decades. In Finland, they have used xylitol during the preschool years, when the children are 3, 4, 5 years old, when they just have these molars in the back teeth. And by giving these children xylitol regularly, they usually do it 3 times a day, they are able to get rid of plaque bacteria that literally, when they feed on xylitol, stop growing, become slippery because they can't make the little sticky pads that stick themselves to the teeth, so they gradually get washed away. And the xylitol feeds, it's a prebiotic, it feeds the good bacteria that then get in these grooves. And once they're in the grooves of these baby molars, those grooves are almost like little fountains of good bacteria in your child's mouth. And those good bacteria defend your child from errant bacteria that could be looking to cause cavities. They literally push them out of the mouth. In these programs in other countries where children are given xylitol young enough, and I have done this with my own child and children and grandchildren, they are able then to sort of miraculously make it through life with perfect teeth. Yes, you have to control sugar eating. You have to keep it so that this toddler isn't constantly snacking on sugar or carbohydrates. And you do this by having meal times more pronounced, more defined, eat and drink whatever you want at a meal, and end with some xylitol. As your toddler gets to being about 1.5, 2 years old, that was the age I started my kids and grandkids using the product that I have, the product I formulated, mint, called Cherry Berry. It's a berry-flavored mint that's absolutely sweet and delicious. If you give them 2 mints when you're storytelling right before they go to sleep, those mints will dissolve in their saliva, and that will get rid of the plaque that you're worried about. I never flossed a single tooth of my children, my grandchildren, and none of them got cavities. And don't tell me their teeth are crowded. Your saliva goes better between the teeth and cleans them than any amount of mechanical flossing can do. And there are no studies to show otherwise. When you go to the dentist, bear in mind I'm teaching you real prevention, changing the bacteria in the mouth so that they are healthy. Pediatric dentistry only focuses on preventive treatments. They would be fluoride treatments. Fluoride treatments are to help a tooth repair itself. They do nothing, at least not the fluoride treatments I would ever have you have. Very strong fluoride can kill bacteria, but I don't recommend you do that. The other thing that preventive treatment would do is to seal up these grooves, to say, we don't know how to stop these bacteria, so we're just going to block up the grooves so they don't get into these teeth. Why eliminate the habitat of healthy bacteria? You may be changing the outcome for the rest of your child's life. We know that these healthy bacteria in a 4 or 5-year-old transfer into the grooves of the new adult tooth, and those new adult teeth will carry those into the adult mouth. I would highly recommend avoiding sealants and using xylitol as a far preferred preventive strategy.